السلام عليكم ورحمة الله وبركاته. الصوت واضح يا جماعة؟ شايفين السكرين؟ Good morning everyone. You can see my screen. My voice is clear for all. فتحت لكم الشات يا جماعة، سامعيني؟ تمام. خلاص we'll start إن شاء الله at 10:15 exactly, waiting for the other colleague to join. اوكي، هنبتدي إن شاء الله الساعة 10:15 لحد ما باقي زمايلنا يعملوا joining. تمام؟ يعني 5 دقايق بإذن الله وهنبتدي. السلام عليكم ورحمة الله وبركاته. صباح النور عليكم جميعا. رابط التحضير بيجهز وإن شاء الله بإذن الله هنرسله ليكم 5 دقايق و10 دقايق بالكتير لحد ما نعمل بس الكويك ريفيو. إن شاء الله بإذن الله نخلص النهاردة بدري. هنعمل كويك ريفيو what we discussed yesterday about definition of communication. Who can tell me the definition of communication, general definition of communication؟ يعني إيه التواصل؟ إيه هو مفهوم التواصل؟ Who can remind me؟ مين يقدر يذكرنا بتعريف التواصل؟ الجنرال ديفينيشن، إحنا لسه ما اتكلمناش هو effective ولا مش effective؟ الجنرال ديفينيشن للكوميونيكيشن. فين الجروب؟ أهلا يا نجوى، أهلا يا فلك. الماس أهلا يا حبيبتي، اتفضلوا. who can remind me؟ What is the definition of communication؟ يعني إيه تواصل؟ ده حاجة من الأوبجيكتيف اللي أنتوا لازم تطلعوا بيها. by the end of this course you have to know. You have to know. You have to define communication. إيه هو communication؟ إيه هو التواصل؟ أيوة في رابط حضور. أهلا يا ابتهال. في رابط حضور يا حسين. إن شاء الله بإذن الله بنجهز اللينك وهيرسل لكم بإذن الله خلال 5 أو 10 دقايق بالكتير. تمام؟ Yes. Yeah, you can answer in the chat. Almas, you can answer in chat. Okay, no problem. يلا. Process of sharing, conveying, transmitting ideas, information, thoughts, feeling, emotion. صح؟ Between the people. صح؟ تمام. Very good يا ابتهال. طب what is the definition of effective communication؟ قلنا ال effective communication ليه conditions، ليه شروط. عشان أقول إن هو effective لازم فيه مجموعة من الشروط. إيه هي؟ شروط التواصل الفعال اللي موجودة في الديفينيشن. يلا طيب in the chat definition of effective communication. مفهوم التواصل الفعال. You have 2 to 3 minutes. تمام. ده general definition يا ألماس for communication. I mean now what is the definition of effective communication؟ تمام يا سيد. Very good. طيب effective communication بقى. Now we answer the first question, the general definition of communication. طيب effective communication قلنا ايه؟ رايح جاي. رايح جاي ده ايه؟ conditions للeffective communication اللي موجودة في الديفينيشن. شروط التواصل الفعال. عشان أقول إن الكوميونيكيشن ده effective communication لازم تتوفر فيه بعض الشروط. إيه هي الشروط اللي قلنا عليها امبارح؟ Who can remind me؟ تمام. فيدباك يا محمد حاجة منهم. إيه كمان؟ إيه كمان؟ غير الفيدباك إحنا قلنا رايح جاي. رايح جاي ده إيه؟ two way process. two way process. رايح جاي. عندنا transmission phase وعندنا كمان إيه؟ الفيدباك phase. transmission phase والفيدباك phase. قلنا الفيدباك أهميتها في إيه؟ ليه مهم الفيدباك؟ ليه في الافكتيف كوميونيكيشن لازم يبقى فيه فيدباك؟ فيدباك اللي قلنا التغذيه الراجعه. ليه لازم يبقى فيه فيدباك؟ why feedback is important في الافكتيف كوميونيكيشن؟ to make sure إن ال understanding happen. Very good. To make sure دي مسؤولية الفيدباك. To make sure إن ال understanding happen. Very good. يبقى دي أول واحد. إحنا عندنا two way process، في transmission phase وعندنا الفيدباك phase. طيب إيه كمان من شروط ال effective communication؟ ها who can tell me إيه كمان موجود في شروط ال effective communication؟ مين يقدر يقول لي؟ There is another condition يا ألماس for effective communication, not only feedback. There is another conditions for effective communication. To call this communication effective communication. ها قلنا لازم يحصل ايه؟ right message. السندر لازم يطلع right message. right message. الرايت مسج through what؟ ها عشان يطلع right message through what؟ لازم يعمل right ايه؟ ها يا جماعه فكروا معايا، الكلام ده احنا قلناه امبارح. We already discussed this yesterday. We only reviewing. احنا بنراجع بس. We already discussed this yesterday. يبقى في right encoding للمسج. right encoding للمسج. لازم تتكون المسج من كلمات بسيطة صحيحة، الرموز واضحة، يبقى التشفيرة بتاعت المسج correct و right. تمام؟ يبقى في right encoding للمسج. what else؟ ويحصل لها ايه؟ right decoding. مين المسؤول عن الديكودينج يا محمد؟ Who responsible for encoding and who responsible for decoding؟ ها who can answer me? Who responsible for encoding the message and who responsible for decoding the message؟ وضحوا مين؟ وضحوا مين في كل حاجة. Very good يا هبة. تمام. اللي مسؤول عن الانكودينج السندر، واللي مسؤول عن الديكودينج مين؟ الريسيفر. الانكودينج اللي هو تكوين شفرة الرسالة، تكوين المعلومة أو الرسالة. الديكودينج فك الشفرة وفهم الرسالة. لو اتعمل انكودينج صح إن شاء الله يحصل ديكودينج صح. تمام؟ very good. الرابط موجود يا جماعة، الرابط موجود في الشات. دقيقة واحدة. ممكن حد يعمل له شير بعد إذنكم على الشات؟ شكرا يا فاطمة. تمام. Yesterday also we spoke about the importance of communication. Why effective communication is important. ليه مهم؟ ليه مهم؟ ايه هي importance of effective communication؟ ايه أهمية التواصل الفعال؟ ليه لازم نتواصل بصورة فعالة؟ Why we should communicate effectively؟ ليه لازم نتواصل بصورة فعالة؟ ايه أهميته؟ ها why يا عبد العزيز ومحمد why we should communicate effectively؟ ايه اهميته بالنسبه لنا؟ ما احنا بنتواصل يوميا، نتواصل مع زمايلنا في العمل وبنتواصل مع الفاميلي واصدقائنا، ايه اهميته؟ تمام يا دكتور احمد، لكفاءة وجودة الخدمة. ايه كمان؟ تمام. يا جود، ايه كمان؟ for better understanding. تمام، ثانك يو يا محمد. الeffective communication، فاكرين اما قلنا ان الكي element في الeffective communication to make sure ان الاندرستاندينج happen، الاندرستاندينج الفهم، ان حصل فهم صحيح على الرسالة. طيب تاني حاجة، ان انا في الوقت ده طبعا انا فهمت بطريقة صحيحة، هيحصل ايه؟ هقدر اخد decision for better decision making، better understanding، better decision making، صح؟ solving للبروبلم، لان احنا قلنا 80% of our problem the main cause is what؟ ها 80% من من مشاكلنا سببها ايه؟ ها مين فاكر؟ 80% of our problem المين cause what؟ يا عبد الله، المس communication which lead to ادى لايه؟ ها المس communication ادى لايه؟ lead to misunderstanding. very good. يبقى 80% from our problem ها المين cause miscommunication، التواصل ما كانش فعال، lead to misunderstanding للسيتويشن او للمسج. تمام، very good very good. طيب who can remind me بالelements of communication process؟ احنا قلنا communication process دي continuous process صح؟ و2 way process، وشرحنا ال2 way process لان السندر في مرحله الترانسميشن فيز، تمام، بيطلع رساله بتروح للريسيفر، تمام، وفي عندنا في الفيدباك فيز ان السندر في الوقت ده بيبقى ريسيفر، والريسيفر في الوقت ده بيبقى سندر. فعشان كده بنقول ايه؟ 2 way process، رايح جاي 2 way process. very good. طب ايه هم الاليمنتس للكوميونيكيشن بروسيس؟ ايه هي المين اليمنتس في الكوميونيكيشن بروسيس؟ عناصر عملية التواصل يا عبد الله. مين العناصر الأساسية اللي فيها؟ تمام. what else؟ ها تمام يا بدر. what else يا بدر؟ عندنا many elements in communication process، وقلنا ان هي continuous process، عمليه مستمره. السندر بيبقى ريسيفر، والريسيفر بيبقى سندر، ترانسميشن فيس وفيدباك فيس، فاكرين؟ يبقى السندر، الريسيفر، المسج، الانكودنج، الديكودنج. فيري جود يا محمد. الميديا او الميديم اللي طلعت فيه الرساله، الفيدباك، تمام، كل دي element. وقلنا ان كمان، طب خلينا بس الاول الميديم. who can give me example for medium؟ وايه هو الميديم؟ like phone، like email، WhatsApp. very good. fax or oral. تمام، very good. طيب قلنا noise also one element of communication process or affecting the communication process. Who can give me example for noise in communication process? Who can give me example for noise in communication process? ها ايه كمان؟ ايه كمان؟ النويز، example للنويز اللي بيحصل في الكوميونيكيشن بروسيس واللي بيعمل obstruct الكوميونيكيشن بروسيس ويعتبر barrier للكوميونيكيشن وبيأفكت على الكوميونيكيشن بروسيس like what؟ ايه كمان؟ الباد انترنت كونكشن، الباد تليفون كونكشن، ها faulty encoding، الفولتي decoding، الانترابشن. very good. كل ده بيأفكت على الكوميونيكيشن بروسيس او inattentive receiver. الريسيفر اصلا مش مركز معايا. inattentive receiver. very good. Yesterday also we spoke about the communication styles. ايه هي communication style؟ How many style we discussed yesterday؟ وايه هم؟ And what are these styles؟ تمام. very good. Total how many؟ We have four styles. Four basic communication style. الباسيف، الأجريسيف، الباسيف أجريسيف والأسيرتيف. قلنا مين الهيلثي والإفكتيف كوميونيكيتور؟ ها يا جماعة، مين الهيلثي والإفكتيف كوميونيكيشن ستايل؟ which one؟ which one؟ مين الهيلثي؟ الهيلثي. very good. الassertive. ليه قلنا عليه healthy و effective communication style؟ Who can tell me how you can recognize الassertive communicator؟ ازاي تتعرفوا على الassertive communicator؟ How you can recognize from behavior, from phrases like what؟ ها who can tell me؟ يلا. type in the chat common behavior and common phrases for assertive communicator. You have 2 minutes, huh? ها يا جماعة، قلنا إن الassertive communicator ودي الeffective والhealthy way of communication دول الناس بقى اللي بيتواصلوا بطريقة فعالة فيها ثقة بالنفس، بيبقى في self confidence high self confidence، بيبقوا منتين للeye contact بيبقى في تواصل بصري، تمام، بيبقى في balanced conversation. They are giving a chance for the other people to express their point of view, their feelings, their emotions. Very good. Good listeners. Very good. Good listeners. They are listening for the others. Okay. وفي equal opportunity for all during a conversation to talk and speak. Very good. They can say no. They can say no. Okay. Very good. طيب للباسيف communicator, how you can recognize الباسيف communicator؟ How you can recognize الباسيف communicator؟ difficulty. قلنا الناس دول عندهم difficulty في expressing الemotion, expressing الفيلينج، صح؟ الايدياز او الثوتس، وده بيدخلهم في مشاكل كتيرة. تمام. very good. no eye contact. very good. always going with the flow. very good يا عبير. going with the flow. very good يا سعود. very good for all. تمام يا محمد. cannot say no for something. very good. طيب الاجريسيف communicator بقى الشرير ده، ها how you can recognize الaggressive communicator. how you can recognize aggressive communicator. very good. تمام يا سعود على طول. very good. speaking loud, criticizing. تمام. very good يا الماس. على طول pointing the finger, didn't give any chance for anyone to speak, to talk. على طول dominating, want to dominate the conversation. very good. talking over the other people. no listening. ما في listening. على طول threatening لل other people. staring, frowns. على طول بيبص بنظرات حادة. الاي كونتاكت بتاعه فيه يعني بنظرات حادة. تمام. في اي كونتاكت يا فوزية، بس مشكلته الاي كونتاكت بتاعه حاد كده، مرعب. تمام تمام. very good. طيب how you can recognize الباسيف aggressive communicator. how you can recognize الباسيف aggressive communicator. قلنا ده تو فيسز. السوبرفيشال فيس، السوبرفيشال فيس اللي هو بيبقى عامل ازاي؟ الباسيف والهيدن اجريسيف. السوبرفيشال باسيف والهيدن اجريسيف. تمام. فدايما تبقى انت في كونفيوجن، مش عارف ليه. ايه اللي بيخليك انت في كونفيوزد؟ ايه اللي بيوصل لك منه يخليك confused؟ ها؟ ليه؟ ايه هي common behavior ليه يخليك دايما confused؟ انت مش عارف هو يعني هو aggressive ولا passive؟ ايه الcommon behavior للباسيف aggressive communicator؟ نتعرف عليه ازاي؟ how you can recognize؟ how you can recognize الباسيف aggressive communicator؟ very good يا عبير. قلنا ان الفيشيال expression not matched مع التوكينج اللي بيقوله، مع السبيكينج، مع كلامه مش ماتشد. الوردس not align مع الاكشن. تمام؟ ده مش ماشي مع ده على طول. sarcastic. تمام. ايه كمان؟ after saying something broadly، يقول ايه؟ or damaging للشخص اللي قدامه او sarcastic للشخص اللي قدامه، يقول ايه؟ I'm just joking. after saying something in rudely way or something sarcastic or damaging للpeople، يقول ايه؟ I'm just joking. انا بس كنت بهزر. دي مشكلة الباسيف aggressive communicator. تمام؟ يبقى على طول sarcastic، الوردز do not align مع الاكشن، الفيشال expression مش align مع الوردز اللي بيقولها. تمام؟ على طول after saying something rudely أو something damaging للpeople or sarcastic، I'm just joking. difficulty to acknowledge الemotions بتاعتهم والفيلينج، لأنه two faces، ما تبقاش عارف، تبقى confused. تمام؟ واضحين لحد دلوقتي؟ في أي سؤال في الأجزاء اللي احنا رجعناها؟ الأمور واضحة للجميع؟ تمام، ما فيهوش مشكله يا جماعه. اللي ما سجلش في الرابط، احنا كمان كده كده بيبقى الزوم بيبقى فيه تسجيل للحضور، بيتسجل من على الزوم. تمام، فما تقلقوش، سجلوا النهارده وما تقلقوش. حد بس يعمل شير لرابط التحضير بعد اذنكم. بعد اذنكم اعملوا شيرنج لرابط التحضير. خليني انا. تمام. Yesterday also we spoke about the principles of communication، مبادئ التواصل. Who can remind me how many principles we discussed yesterday؟ ها؟ أو قولوا لي إيه اللي فاكرينه من البرنسبل؟ Principles of communication. Principles of communication. تمام يا سعود، كان في الفيدباك. Very good. What else؟ الكونسيستنسي. Very good. احنا بنتكلم يا فوزية عن principles of communication. الكلاريتي. Very good يا عبير. What else؟ الاديوكسي. ها. What else؟ الانتجريشن. فاكرين الانتجريشن؟ الايكونومي. Very good. In need for communication network. Very good. Very good for all. طيب who can tell me types of communication؟ ايه هي انواع التواصل؟ تمام. verbal و non-verbal communication. verbal اللي هو اللفظي والnon-verbal الغير لفظي. طب الverbal ليه sub types under verbal اللي هي ايه؟ الwritten. very good. الvisual. الoral. اوكي. طيب who can give me example for non-verbal communication؟ ايه هو non-verbal communication؟ non-verbal communication. Who can give me example for non-verbal communication؟ طبعا زي اشارات المرور دي في الفيجوال يا عبد الله. non-verbal. very good. البادي لانجوج، لغة الجسد، الاي كونتاكت، الفيشيال اكسبريشن، الجيتشرز، البوتشرز. very good. very good. طيب مين يقدر يقول لي مين اقوى النون فيربال ولا الفيربال كوميونيكيشن؟ مين اللي بيوصل اكتر المسج، الفيربال ولا النون فيربال؟ النون فيربال. فيري جود. دايما النون فيربال بيبقى اقوى من الفيربال كوميونيكيشن. طيب يا جماعه who can remind me ايه هي الباريرز للكوميونيكيشن؟ what are barriers for communication؟ very good. who can give me example for physical barrier؟ Who can give me example for physical barrier؟ physical barrier like what؟ like what يا جماعة؟ زي ايه الفيزيكال barrier؟ physical barrier like what؟ تمام. الناس اللي عندها hearing impairment، الفيجوال impairment، كل دي barriers للcommunication. طيب كمان اتكلمنا على الculture barrier like what؟ ازاي الكالتشر في بعض الأحيان بتمثل barrier لينا في التواصل؟ زي ايه؟ الكالتشر دايفرستي، الكالتشر دايفرستي تنوع الثقافات واختلافها للعادات والتقاليد، زي الاي كونتاكت in some culture يعني مش مسموح بيه او مش مستحب، especially لو انت health care worker او health care professional male والبيشنت female، فالاي كونتاكت غير مستحب. في بعض الثيرابيوتيك تاتش في بعض الكالتشر not accepted. تمام. what else في الباريرز؟ physical، تمام، culture، وكلمنا كمان على الاورجانيزيشنال بارير. like what organizational barrier؟ organizational barrier. we spoke also about الاورجانيزيشنال barrier. على مستوى الاورجانيزيشن يبقى في بارير ازاي؟ على مستوى الادمنستريشن مفيش line of communication، مفيش clear policies وبروسيجر للcommunication، staff not following a line of communication أو line of authority، الادمنستريشن الدايركتور أو المانجر عامل close للcommunication مع الستاف أو مع السبوردينيتس، فدي بردك بتبقى بالنسبة لنا مشكلة. تمام. طيب اتكلمنا كمان على interpersonal barrier. interpersonal barrier like what؟ interpersonal barrier. قلنا ده على مستوى العلاقات، يبقى في personal problems between الفريندز او between الكوليجز في العمل، يبقى في lack of trust، يبقى في conflict، يبقى في poor relationship. طبعا كل دي barrier للcommunication بيؤدي الى poor response. حتى لو حصل communication يبقى الريسبونس poor، يبقى في poor listening poor response. تمام، فيبقى barrier للcommunication. طب how؟ وكمان we mentioned also there is linguistic barrier. يعني ايه linguistic barrier؟ يعني ايه linguistic barrier؟ linguistic barrier اللغة، مشاكل في اللغة. زي ايه؟ we gave example yesterday for that. give me this example. تمام very good. قلنا example في الهوسبيتالز many nursing non-Arabic speaker and majority of our customer is Arabic speakers. This is a big linguistic barrier in the hospital. Nursing, they have role in patient family education, how they will explain, how they will educate the patient and family. We have language barrier here. طيب, who can inform me how we can overcome a linguistic barrier? How we can overcome this barrier? How we can overcome a linguistic barrier in hospitals? ها لا يبقى each hospital should have very good translator. أيوة to prepare a translator list for each language in the hospital. They have to have one translators, can be from the staff يعني. Okay, some Indian staff they can translate the Hindi, English, anyone can translate, no problem. From the hospital. French, يبقى we should have translator for each language. We should have translator list. In case we need this translator, you can call the translator to translate for the patient. Okay? تمام. Yesterday also we spoke about effective communication technique. The first one is the first one. In effective communication techniques. Very good. Listening. قلنا listening ليه شرط؟ لازم يكون active listening، يعني listening with concentration، listening with attention. Okay? Very good. Very good. طيب ايه هي التيبس؟ التيبس for active listening. التيبس for active listening. Who can tell me ايه هي التيبس for active listening؟ Very good. Attention. Don't speak. Okay. Ask questions for clarification. Maintaining the eye contact. تبقى في الاكتف body state. واضح ان انت اصلا على القعده بتاعتك ان انت بتسمع بانصات. What else؟ تبقى focus على الكونتنت not focus على البيرسون. Very good. You have to take care from non-verbal cues. Not only verbal, take care also from the non-verbal. Don't interrupt. Very good. Very good. Give feedback. Not judging. Very, very good. طيب, we mentioned also yesterday types of feedback. Who can tell me the types of feedback? Types of feedback. 4 أنواع للفيدباك، التغذية الراجعة. إيه هما؟ الفيدباك ممكن يكون clarifying feedback للتوضيح عن طريق البارافريزنج للكلام اللي اتقال. you mean that and that. اوكي تمام، ده اسمه توضيحي. بارافريزنج بارافريزنج اللي هو clarifying feedback. ممكن يكون الفيدباك interpretive، انت شفت observation وعملت لها ترجمه ليها. يعني ايه؟ شفت تيم بيشتغل مع بعض، والله التيم ده يا جماعه في جود تيم وورك معاهم، تمام؟ فدي observation، يبقى interpretive feedback. ممكن يكون الفيدباك judgmental feedback، انت بيزد على اللي انت سمعته رحت حاطط judgment، تمام؟ judgment بيزد على المسج اللي وصلت لك، تمام؟ ايه كمان؟ ممكن يكون الفيدباك كمان personal reaction. والله انت جيت اتكلمت معايا وقلت لي مثلا انت سعيد بحاجه معينه او حاجه كويسه حصلت لك، وانا كان البيرسونال اكشن والله انا سعيده ان انا سمعت منك كده. او انت كنت مثلا قلت لي إيه حاجه حزينه او موقف حصل معاك وانا رديت عليك والله انا حزينه ان سمعت منك كده، فده اسمه بيرسونال رياكشن، انا رديت ببيرسونال رياكشن. تمام؟ بفيلينج باموشن. تمام. طيب خلاص كده يبقى الفيرست تكنيك في الافكتيف كوميونيكيشن تكنيك نمبر 1 الايه الليسننج، ولازم يكون اكتف listening. نمبر 2 ها في الافكتيف كوميونيكيشن فاكرين نمبر 2 كان ايه؟ نمبر 2 كان ايه؟ كان السبيكينج اتيكيت. فاكرين السبيكينج اتيكيت؟ اتيكيت التحدث، ازاي نتحدث باتيكيت. ايه هو اتيكيت التحدث؟ Who can remind me? speaking etiquette. تمام. تمام. فاكرين لما قلنا avoid للوردز اللي هو اللي هي اللزمات. اللزمات كلنا عندنا لزمات، فavoid لللزمات دي. تمام. don't engage in conversation or any new topic and you don't have the knowledge about it. Okay? Don't engage in any conversation or talk about new topic and you don't have the knowledge in this. Why? ليه ما نتكلمش في موضوع او حاجه حصلت احنا ما نعرفش فيها؟ ليه؟ لان انت لو اتكلمت واديت معلومات خاطئه ده هيأثر على ايه؟ فاكرين قلنا هيأثر على ايه؟ على الكريديبيليتي، هيأثر على المصداقيه بتاعتك. وعلى ثقتهم بيك، على المصداقيه، هيأثر على المصداقيه، الكريديبيليتي will affect on credibility. تمام. number 3 الكونكتنج في التكنيك. connecting اللي هو ايه connecting؟ الconnecting قلنا في الconnecting you have to focus in your listeners او الاودينس، لازم يبقى فيه participation، لازم يبقى فيه involvement. they should be involved in the conversation. Okay. What else in the connecting؟ قلنا لازم كل الكوميونيكيشن يبقوا aligned مع بعض، يعني الفيربال كوميونيكيشن مع النون فيربال لازم يبقى فيه alignment مع بعض. تمام. كلامك يبقى ماشي مع التعبير الوجه، مع جلستك، مع الاي كونتاكت، يبقى كله متماشي مع بعض، يبقى في كونكتنج ما بين كل الفيربال والنون فيربال كيوز. اوكي. واضح يا جماعه؟ في اي سؤال لحد دلوقتي؟ تمام. yesterday we define also therapeutic communication which is our main topic for today. ايه هو therapeutic communication for us بقى the healthcare professionals؟ ايه هو therapeutic communication؟ This is our main topic for today, therapeutic communication. ايه هو therapeutic communication؟ ده الكوميونيكيشن between الهيلث كير workers أو الهيلث كير بروفيشنال والبيشنت as well as البيشنت family. تمام. yesterday we differentiate between الهيلث كير workers والهيلث كير بروفيشنال، صح؟ ها who can remind me؟ ايه هو الديفرنس between health care worker والهيلث كير بروفيشنال؟ who can tell me the difference between the health care worker والhealth care professional؟ ها الناس البروفيشنال زي ما احنا قلنا، ناس اللي هم licensed to provide health care service based على السبيشاليتيز بتاعتهم، زي النيرسز، زي الفيزيشن، التكنيشنز، الفارماسيست. لكن الهيلث كير وركر anyone work في health care organization بنسميه health care worker، even admin staff, receptionist, security, kitchen, everyone work in healthcare institution called healthcare worker. Let's watch one video and we'll start our part 2 in our course therapeutic communication. Okay, 1 minute. Sorry. نعمل له share with sound.
Important aspects of effective communication. In today's high-tech, high-speed world, we seem to listening is one of the most important aspects of effective communication. In today's high-tech, high-speed world, we seem to devote less and less time to really listening to one another. Genuine listening is a skill, and it's a really powerful tool you can use in the workplace. By improving your listening skills, you can make a speaker feel heard and understood. This helps build stronger, deeper connections between you and your colleagues. A good listener creates a workplace environment where everyone feels safe to express ideas, opinions, and feelings. They can creatively solve problems in partnership, and they can save time, avoiding conflict and misunderstandings. They can also help relieve negative emotions. When a person feels that he or she has been truly heard, it can help calm them and allow for understanding or problem solving to begin. There are 4 key skills which you can learn to unlock the power of effective listening. Number 1, focus fully on the speaker. You need to really concentrate on the person speaking and pay special attention to their body language and other non-verbal cues. If you start to daydream, doodle, or check social media, then you're certain to miss non-verbal cues in the conversation. Okay, some speakers can be really boring, so if you're finding it hard to concentrate, try repeating their words over in your head. It will reinforce their message and help you stay focused. Number 2, avoid interrupting. It's very common for people to interrupt one another when communicating. Have you ever been speaking with a colleague or manager and it seems no matter what you do, you keep getting interrupted? You begin a sentence, then suddenly someone jumps in to complete it. It's very frustrating, isn't it? You feel like you're not being heard. If it happens often enough, you might even stop contributing to the conversation altogether. Furthermore, you decide the person interrupting you is rude and your relationship is damaged forever. So why do people do it? Well, on average, humans speak at a rate of 125 to 150 words per minute. But the human brain can comprehend and listen at the rate of 600 words per minute. This means that our minds are underutilized when listening to others. We therefore struggle to keep our minds on topic. You might hear 1 or 2 phrases of the conversation and jump ahead to a solution or share a previous experience. Our boredom can inadvertently create a separate conversation. There are simple tricks you can practice to interrupt your interrupting behavior. For example, try to close your mouth whilst listening. People often open their mouths to signal to the other person that they are ready to talk. When in a conversation, imagine a drop of glue on your lip. Focusing on keeping your mouth closed will stop you interrupting someone. Another tip is to make a note during the conversation. We now know that our brains operate much faster than others can speak, so it's natural that we have ideas we don't want to lose, and this can lead you to interrupt someone. To combat this urge and avoid losing the idea, write it down. Continue to listen, but make a note of the points you want to make when it's your turn to talk. Finally, try to change your focus. Think about listening more than talking. Simply change your goal for the conversation to listen more than you speak. This change in focus can have a drastic impact on your success in curbing your interruption habit. Chances are one of the points we just covered speaks to you directly. Focus on that method and use it in your very next conversation. Number 3, avoid seeming judgmental. In order to communicate effectively with someone, you don't have to like them or agree with their ideas, values, or opinions. However, you do need to set aside your judgment and withhold blame and criticism in order to fully understand a person. The most difficult communication, when successfully executed, can lead to the most unlikely and profound connection with someone. Number 4, show your interest. You need to look interested in what the other person is saying. Try to nod occasionally, smile at the person talking, and make sure your posture is open and inviting. Encourage the speaker to continue with small verbal comments like yes, right, and really. You can even show you are listening with non-words such as or uh-huh. If your goal is to fully understand and connect with the other person, then listening effectively will often come naturally. If it doesn't, you can remember the 4 key skills you've just learned. The more you practice them, the more satisfying and rewarding your interactions with others will become.
Learning gets better only when you are taught one-on-one by expert tutors. The
Let's continue. Therapeutic communication is the communication between a healthcare worker and patient, as well as the patient family, that takes place to advance patient well-being and care. اوكي، طب ايه هي البيربوسز للثيرابيوتيك كوميونيكيشن؟ ليه مهم الثيرابيوتيك كوميونيكيشن او التواصل العلاجي اللي بيحصل ما بين الهيلث كير وركرز والبيشنت فاميلي؟ ليه بيربوس؟ ليه غرض؟ ايه هو الغرض منه؟ to collect health care related information. ده التواصل اللي بيحصل ما بين الفيزيشنز والنيرس مع المريض. تمام، الغرض منه بياخدوا history من المريض، بجمع information collect health related information about the patient to provide feedback in the form of health related information. بديله information، بديله education، بديله training. فده نوع من الكوميونيكيشن مع البيشنت والبيشنت فاميلي. to assess the patient behavior، بنقيم سلوك المريض، عشان لو في سلوك unhealthy behavior we need to modify this behavior to healthy behavior. We would plan to improve this behavior and to change this behavior from an unhealthy behavior to a healthy behavior. يبقى المين purpose للtherapeutic communication between the healthcare worker والpatient family, number one, to collect health related information about the patient, to provide feedback in the form of healthcare related information or education, training for the patient, to assess the patient behavior when necessary, to modify the patient behavior from an unhealthy behavior to healthy behavior. دي الكويسز اللي احنا عملناها امبارح. طيب، أول حاجة في الثيرابيوتيك communication you have to build rapport with the patient. Rapport with the patient. Who can tell me what is the meaning of word rapport? First, what is the meaning of word rapport? جماعة كل يوم، معلش أنا ما خدتش بالي، كل يوم ليه رابط للحضور. امبارح كان ليه رابط والنهارده كان ليه رابط تاني. تمام؟ يبقى ايه هو الرابر؟ ده sympathetic relationship or understanding that allow you to look at the world from someone else's perspective. دي طبعا will differentiate between الsympathy والempathy شوية، يعني maybe next slide we will differentiate between الsympathy والempathy، العطف والتعاطف. هنفرق ما بينهم الاثنين، الempathy والsympathy. لكن الرابور ده sympathetic relationship or understanding. انت بتفهم، بتحط نفسك في موقف شخص تاني من وجهة نظره، بتشوف الورلد من وجهة نظر شخص تاني. Look at the world from someone else's perspective. تمام؟ Ways to build rapport with the patient. ازاي to build rapport with the patient as a physician or as a nurse? How you will see the world from the patient perspective. How؟ ايه الways اللي انتوا تتبعوها عشان تشوفوا الورلد من البيشنت برسبكتيف، من وجهه نظر البيشنت او البيشنت فاميلي. يبقى ways to build rapport مع البيشنت، understanding or relationship, sympathetic relationship with the patient. How you can build rapport with the patient? First, we need to understand the difference between empathy and sympathy. empathy، مين يقدر يقول لي الامباثي هو العطف ولا التعاطف؟ who can tell me الامباثي هو العطف ولا التعاطف؟ الامباثي very good. الامباثي اللي هو العطف، السيمباثي هو التعاطف. very good يا فوزية. تمام يا أمير. يبقى الامباثي هو العطف، لكن السيمباثي اللي هو التعاطف. طب ايه الفرق ما بين الامباثي والسيمباثي؟ الامباثي experiencing the feeling of another، يعني انا مريت بتجربة الشخص ده قبل كده، فانا عارف الفيلينج، حاسس بيه. تمام. you have similar personal experience، فيها جزء emotion شوية. لكن السيمباثي understanding the suffering of another one but may not experience this before. You acknowledge another circumstances. This recognition على مستوى المايند شوية، لكن الامباثي دي على مستوى الايموشن والهارت. ليه؟ لأن أنت experiencing the feeling of another. Okay? You have similar personal experience. ممكن تكون ليك يعني موقف شبيه مع، يعني مثلا طبيب بيعالج مريض مثلا وعنده نفس المرض بتاع والده اللي توفى بيه قبل كده، فهو بيبقى فيه هنا امباثي. امباثي يبقى فيه عطف. ليه؟ لان هو مر بالمشاعر دي، مر بالموقف ده مع والده. تمام. يبقى دي اسمه امباثي، عطف. لكن سيمباثي انا ما مرتش بالموقف ده قبل كده، بس انا متفهم، انا understanding السفرنج ده على مستوى المايند. تمام. لكن الامباثي في شويه ايه على مستوى الهارت. تمام. يبقى السيمباثي انا ما مرتش بالموقف ده قبل كده، but انا I can understand the suffering بتاع another person. تمام. I acknowledge another circumstances، ده recognition. لكن الامباثي ده فيه emotion. واضح الفرق يا جماعه بين الامباثي versus السيمباثي، العطف والتعاطف؟ ها؟ واضح؟ واضح الفرق ما بينهم الاثنين ولا نعيد تاني؟ يبقى الامباثي ده على مستوى الايموشن experiencing the same feeling. Okay, experiencing the feeling of another. You have the similar personal experiences. لكن السيمباثي انت ما مرتش بالتجربه دي قبل كده، بس في understanding the suffering of another person. ده في recognition. You acknowledge another circumstances. يبقى الرابر ده sympathetic relationship or understanding. Okay, للpatient situation. You look at the world from another one perspective. انت هتشوف الworld من الpatient perspective. طيب ways to build rapport with the patient. Number one, you have to maintain eye contact with the patient. لأن الeye contact ده بيرفلكت respect للpatient وattention وinterest، إن أنت عايز تسمعه، إن أنت مهتم بيه، interested في الpatient situation. Maintaining eye contact communicates care and compassion. It can also show empathy and interest in your patient situation. Eye contact and social touch connects you to your patient and communicates understanding. Show empathy للpatient. لو انت مريت بالتجربة دي you have to show empathy. It is the ability to understand the patient situation, perspective and feeling. It allows you to deliver more personalized patient care. يبقى number one, to maintain eye contact, show empathy to the patient, open communication with the patient. One study found the good communication to be a key factor in improving the patient outcomes. كمان بتحسن open communication مع البيشنت مع الفيزيشن والنيرسز مع البيشنت، ده بيحسن البيشنت outcomes، بيحسن البروجنوزس بتاعهم. تمام. Understanding your patient communication preferences and state of mind will help build rapport. informing your patient of new orders or changes in their condition is way to do this. يعني لما نيجي physician should explain to the patient and should inform the patient ايه هي البلان اوف تريتمنت، ايه خطه العلاج بتاعته. طب انا ضفت له ميديكيشن جديد، اثناء المرور لازم يقول له I add new medication for you، وده عشان كذا وده سببه كذا والاكشن بتاعه كذا والانديكيشن كذا. فده بيحسن الكوميونيكيشن مع المريض. تمام. فلازم اي اوردر او اي تريتمنت بلان physician should explain للبيشنت. تمام. patient involvement in everything. Make it personal. Being a patient can be scary. To help ease their stay, take the time to get to know your patient. Ask about their friends, family. This is the social side of the patient. Ask the patient about their friends, their families, their hobbies, and other important aspects of their life. This communicates your desire to understand them as a person, not only as a patient. يعني ask about family, how many children you have، ايه الهوبس بتاعتك، طب الفريندز بتاعتك اصدقائك مين، عددهم قد ايه. ده بيحسن الكوميونيكيشن مع المريض وبيفهم المريض ان انت بس مش بتتعامل معاه كمريض بس، لا انت بتتعامل معاه كبيرسون not only as a patient. active listening. الاكتيف listening احنا متفقين عليه. اسمع اكتر. Listen with attention. Close your mouth and listen. Close your mouth and listen. Active listening is an essential holistic healthcare tool. It is non-intrusive way of sharing patient thoughts and feelings. To practice active listening, we have steps. صح؟ Listen to what the patient is saying. Repeat what you hear to the patient اللي هي البارافريزنج، الفيدباك البارافريزنج. Check with the patient to ensure your reflection is correct. The goal of active listening is to reflect the feeling or intent behind their words. You should listen to understand, not to respond. Listen to understand, not to respond. انت بتسمع عشان تفهم البيشنت feeling, thoughts, everything about the patient. بس مش عشان ترسبوند عليه، ترد عليه. تمام. يبقى again put this in your mind. Active listening, active listening, active listening. Close your mouth and listen actively to your patient. You should listen to understand عشان تفهم, not to respond. Put this in your mind. طيب احنا عندنا مجموعه من البيشنت اللي بيبقى عندهم disabilities. تمام. فانا ازاي انا كطبيب في العياده او كنيرس او whatever patient admitted عندي how I can interview patient with special need and disabilities. We have many disabilities with special need, patient with a special need. How we can interview them, how we can communicate with them. Who can give me example? How we can communicate with the patient with special needs? How we can interview the patient with special need? تعرفوا ايه عن الموضوع ده؟ Speaking with the patient. الفاميلي هيلب. تمام يا صفاء. ممكن يبقى لو معاه واتشر. تمام. او حد ريلاتيف من الفاميلي. What else؟ ايه كمان من خبرتكم كده بتعملوا ايه؟ From your experience, يا عبير, did you interview before patient with special need or disabilities? What you did with this patient? How to communicate with this patient? ايه اللي عملتوه مع المريض ده بتاع السبيشال نيد؟ تواصلتوا مع الفاميلي؟ لا، هو جاي للطبيب في العياده ومعاه نيرس وعنده سبيشال نيد، مش شرط يكون محتاج طبيب نفسي، مش كل السبيشال نيد. تواصلتوا مع العائله. تمام. avoid showing pity. تمام. ايه كمان؟ بالعائله برضه. تمام. طيب, let's discuss this all because we have many special needs. Patient with hearing impairment, patient with vision impairment. We have many disabilities. How we will deal with these disabilities? Inshallah, we'll discuss this today one by one for each disability. What we will do, how we will interview them, how we will communicate with them, how to show them the interest without neglecting or focusing with their disabilities, what we will do exactly with them. Okay, let's start. Before the interview, قبل ما نبدأ الانترفيو، لو أنا مثلا عندي appointment للبيشن وأنا عارف البيشن ده عنده disability أو عنده special need معينة، أنا هعمل إيه؟ Before الانترفيو, ask the interviewee if he or she require any specific accommodation, such as wheelchair access, quiet place in which to be interviewed, محتاج interpreter معانا أو حد من الsign language يبقى موجود. If you are unsure about how to provide accommodation, ask the interviewee أو البيشنت family، نسألهم إيه اللي محتاجه بالظبط عشان نجهز له الانترفيو. محتاج access to wheelchair لو هو عنده مثلا اي disability في الموبيليتي او مثلا عنده paralysis، ايه اللي نقدر نعمله بالظبط. محتاج interpreter، محتاج حد sign language معانا، فاحنا بنسأل قبل الانترفيو. Allow plenty of time for the interview. Some will require additional time. لو انت عامل للنورمال بيشنت مثلا الانترفيو للنورمال بيشنت 15، لا take care البيشنت ده will take from you more time. تمام، ممكن يوصل لساعة. to put in your mind ان البيشنت ده allow plenty of time for interview. Some will require additional time. احنا عندنا ميني special need. We have hearing impaired, visual impaired, اللي عنده speech impaired, Empathic, non-English speaking, illiterate، الناس كمان low level of understanding. في ناس understanding بتاعها بيبقى صعب شوية، فاحنا بنعمل ايه مع كل واحد فيهم؟ what we should do. لا، في عرض يا عبير، انتوا مش شايفين البرزنتيشن؟ البرزنتيشن واضحة يا جماعة، شايفينها؟ interviewing the patient with special needs واضحة للجميع؟ ايه ده، مفيش برزنتيشن؟ كله شايفها موجودة؟ طيب تمام. انا قلت كل ده بنشرح وانتم مش شايفين البرزنتيشن؟ طيب الحمد لله، الحمد لله. طيب يا جماعة، اللي مش ظاهرة عنده البرزنتيشن اطلع وادخل تاني، لان باقي الزملاء ظاهرة عندهم. ها، طلعتوا ودخلتوا تاني قبل ما نكمل؟ اللي عنده مشكلة في العرض يطلع ويدخل تاني. أنا شايفة حوالي 3 أو 4 العرض مش ظاهر لهم. ضبطت معاكم والّا لسه؟ طيب اللي مش ظاهر معاهم يا جماعة شُعاع وحد تاني قال لي مش ظاهر، اطلعوا وادخلوا تاني، أنا منتظراكم. طيب تمام. خلّينا نشوف فيديو كلّنا مع بعض ونرجع نكمّل تاني. دقيقة.
Hospital or doctor's office can be an intimidation. For people outside of the medical profession, a hospital or doctor's office can be an intimidating place. The job of making a patient feel comforted and cared for often falls on the shoulders of the nurses. To best meet the needs of a patient, nurses must learn the principles of therapeutic communication, which is defined as communication strategies that support a patient's feeling of well-being. This term is easy to recall if you remember that something that is therapeutic is done to help a person cope with the situation and ultimately feel happier and more relaxed. The goals of therapeutic communication are to help a patient feel cared for and understood and establish a relationship in which the patient feels free to express any concerns. In this lesson, we'll explore the different types and principles of therapeutic communication. Did you ever play a game of charades? If you did, you know that the object of the game is to convey meaning without using words. Without words, you need to rely on things like facial expressions, body language, and eye contact. Like a player in a game of charades, a nurse must be aware of his or her own nonverbal or non-spoken communication style. For example, If a nurse does not make eye contact with a patient who is describing a symptom or leans on a desk with her arms crossed, the patient may feel that the nurse is not interested in what they have to say. In contrast, a comforting touch on
دقيقة بس. طيب خلينا نشوف فيديو تاني. دقيقة واحدة. طيب يا جماعة في مشكلة في الفيديو دلوقتي، خلينا نشوفه بعد البريك. هديكوا بريك دلوقتي عشان صلاة الظهر قربت خلاص، الساعة 12 إلا ربع، ونرجع إن شاء الله بإذن الله أفتر 1 اور. ممكن نرجع إن شاء الله بإذن الله الساعة 1، هيبقى هو بريك واحد وبعد كده نرجع نخلص. أوكي تمام. ناخدوا بريك للصلاة، اللي حابب ياكل حاجة يشرب حاجة في الوقت ده، نرجع بإذن الله الساعة 1. تمام. إن شاء الله. السلام عليكم ورحمة الله وبركاته. رجعنا من البريك يا جماعة. الصوت واضح؟ Before our break, we spoke about therapeutic communication. Therapeutic communication. What is the definition of therapeutic communication? قلنا ده communication between the healthcare worker and patient as well as the patient family that takes place to advance the patient well-being and care. طب قلنا ايه هي main purposes of therapeutic communication؟ ايه هي الغرض الاساسي من therapeutic communication؟ to collect healthcare related information about the patient, to provide feedback in the form of healthcare related information or giving education, training for the patient, to assess the patient behavior and when necessary to change or to modify this behavior from unhealthy behavior to healthy behavior. طيب. And we differentiated. Also, we spoke about rapport. What is the meaning of rapport? This is a sympathetic relationship or understanding that allows you to look at the world from someone else's perspective. This is the rapport. طيب, what is the difference between empathy and sympathy? اللي هو العطف, الempathy والsympathy التعاطف. What is the difference? إيه الفرق ما بينهم الاتنين؟ ها؟ ايه الفرق؟ مين يقدر يفرق لي ما بين الامباثي والسيمباثي؟ Who can differentiate between empathy and sympathy? ها؟ التعاطف اللي هو السيمباثي والعطف الامباثي. الامباثي بيبقى على مستوى الايموشن، لكن السيمباثي ده على مستوى البرين، understanding, recognition, acknowledge للفيلينج بتاعت another one او understanding للفيلينج another one. الامباثي بيبقى فيه عطف. ليه؟ لان فيه experiencing للسيم feeling دي before you have similar personal experience with this situation. تمام؟ الحمد لله ان واضح الفرق ما بينهم الاثنين. يبقى empathy اللي هو العطف على مستوى الايموشن، لكن sympathy التعاطف ده recognition, understanding. I can understand your suffering. تمام؟ I can acknowledge your situation. اوكي؟ ده على مستوى recognition، لكن الempathy على مستوى الايموشن. طيب قبل ما نبدأ بقى بالانترفيو let's watch one video 1 minute.
Hi, I want to welcome you to our video series on therapeutic communication. So first we're going to explore communication and then focus it on therapeutic communication for building effective relationships in the healthcare setting. So first of all, let's talk about communication nursing practice. This really just goes hand in hand because in nursing, it's a critical skill for all nurses with clients, families, and our healthcare team members. So why is communication so important? We do it every day. It's our day-to-day practice, but really in the healthcare setting, it helps prevent errors, makes outcomes much better for our patient and a much better patient experience. So any of you ever been in the hospital or a loved one in the hospital, you know that communication is so important with your healthcare providers and your team. So if you have effective communication, you have much better therapeutic relationships. So let's talk about different forms of communication and why those are important. First off, let's talk about verbal communication, which is what I'm doing with you now. It could be spoken or a written word to convey a meaning. So all things are going to influence this, such as how fast did I talk to you? Maybe even the inflection of my voice, how loud, how soft, etc. Something else to think about is even language. Next, let's think about nonverbal forms of communication. This one can be a little bit trickier because it involves all 5 senses in interpretation of its meaning. So things to consider are appearance, maybe how I'm standing, if I have my arms crossed talking to you and maybe frowning. So all of these gestures are going to influence nonverbal communication. Another unique form of communication is symbolic. This is where verbal and nonverbal symbols and icons are used by others. So a great example of this is going to be art and music. This is a great way to communicate in a different form that can be very therapeutic for your clients. Lastly, we have meta-communication. This one's interesting because it's going to be a combination of all factors that influence communication. So what is meta-communication? Well, this is a little bit interesting. So here's an example. Maybe you go to the doctor and you hate needles and you're going to get a flu shot. And as a nurse, I'm going to come give you a flu shot. And if you're squinching away from the needle when you're about to inject me and I say, "Are you okay? Are you nervous about the needle?" And the patient's like, "No, I'm fine, it's fine." Now, if you see that and obviously the person's verbal and their body language are not matching, this is a meta-communication example. We just talked about different forms of communication. Now let's focus on therapeutic communication. This is a collection of techniques that prioritizes the physical, the mental, and the emotional well-being of patients. So for nursing, how does this apply? Well, we have to use these basic forms of communication to connect with our patient and make a therapeutic relationship. So we provide patients with support and information, but we also have to maintain a level of professional distance and objectivity. Okay, now let's focus on specific forms of communication. So we've already talked about verbal and how absolutely important that is, such as the specific written word or spoken. This is definitely needed between nurse and our patient, nurse and our healthcare provider, and just the team in general to make the patient experience better. So let's look at some examples. So things to think about when we are giving verbal communication is, hey, first of all, don't interrupt people, right? Nothing is worse than your patient trying to let you know how they feel. The fact that they're communicating with us is great, but if you cut them off in mid-sentence, that's definitely going to shut off a piece of communication. The other piece is looking at affirming statements. So it's not that we have to stroke their ego necessarily, but just think about when they are saying, yes, I can understand how that's got to be difficult for you. So even those statements are letting the patient know that, hey, you're listening to them, you hear them, and you're on the same page with them. Another thought is to use open-ended questions, such as, hey, how are you feeling right now? If you've ever done this with a loved one or even a friend, you notice sometimes it just opens up the floodgates of the information that you get from that patient. So open-ended questions are a great way to use verbal communication. And next is summarizing it. Believe it or not, it's not mocking the patient. You're letting the patient know you've heard them, such as, hey, what I've heard you said is that this hospitalization has been very difficult for you. These are some things that's been really difficult, such as getting your lab draws or doing some of the tests were very scary. We understand that. So these are great ways of using verbal communication and connecting with your client to make that therapeutic relationship. So next, let's look at nonverbal communication. We talked about how it uses all 5 senses. So don't forget about how your posture is. Also think about your gait, how you're looking at the patient, your facial expressions. Let's think about some nonverbal examples: making eye contact, maintaining personal space, and using therapeutic touch. I know some of these may seem kind of contradictory, but think about maintaining personal space. Let's say your patient's upset, they're letting you know how they feel. Maybe not getting in their personal space is always the best idea. The other thought is therapeutic touch, especially with the use of silence. I think as nurses, we really underestimate trying to talk to patients and trying to fix it for them, or maybe even saying the right things. But sometimes that's just being present, being there for our patient, maybe even putting a hand on their wrist or on their shoulder, and just being present in the moment is all that patient needs. The last thing to think about is the posture. So if someone's talking to you and you're kind of slumped, oh, you don't seem very interested, your body language isn't really making connection with the patient, this can be read wrong. The other thought is, especially in pediatrics, if we're looming over the child while we're taking care of them, this can definitely be looked as threatening for them.
Let's continue. طيب, ways to build rapport with the patient we discussed also before our speak through maintaining eye contact, show empathy for the patient, okay, open communication with the patient. On one study found good communication to be a key factor for improving the patient outcome, okay? Understanding your patient, communication, preferences, state of mind will help build rapport. Informing your patient of new orders or changes in their condition is one way to do this. Okay. Make it personal, social relation with the patient. Ask the patient about friends, family, hobbies, and important aspects of their life. This communicates your desire to understand them, as we mentioned, as person, not only as patient. Active listening, okay, listen to what the patient is saying. Repeat what you heard to the patient for clarification, maybe. Check with the patient to ensure your reflection is correct. The goal of active listening is to reflect the feeling or intent behind their words. You should listen, keep this in your mind. You should listen to understand, not to respond. You should listen to understand, not to respond. طيب, patient interviewing techniques. How to interview patient with a special need, tips for interviewing people with special needs or disabilities. Before interview, you have to ask the interviewee if required, he or she requires any specific accommodation. محتاجين مثلا wheelchair access, or quiet place in which to be interviewed. We need interpreter for the patient, okay? Need sign, someone can use a sign language, okay? لغة الإشارة. If you are unsure about how to provide accommodation, ask the interviewee. Allow plenty of time for the interview. Some will require additional time, not the other normal patient. Normal patient may be in the clinic 15 to 20 minutes. Maybe this patient will take from you more than this, 45, 1 hour, okay? طيب, interviewing the patient with special needs, we have examples here for special needs: hearing impaired, visual impaired, speech impaired, aphasic patient, non-English speaking, illiterate, low level of understanding patient. And we'll discuss in detail how to deal with each patient and how to interview this patient one by one. رابط التحضير اهو يا جماعه. طيب, number, setting up the interview. If the interview has physical disability, be sure there is proper physical access to interviewing area. في access للwheelchair. تمام? You have to make sure ان في access proper physical access للinterviewing area. طيب during interview what you will do when interviewing a person with disability, speak directly للperson and maintain eye contact rather than interacting directly مع interpreter or companion. In case حتى في companion وفي interpreter, you have to maintain eye contact with the patient, not with the interpreter or companion. This number one. This show respect for the patient, interest for the patient. يوضح اهتمام واحترام للمريض حتى لو هو عنده special needs. يبقى when interviewing a person with disability, speak directly to that person and maintain eye contact rather than interacting directly with an interpreter or companion. طيب, use the same interviewing technique and manners that you are usually do. Speak in relaxed, everyday tone, okay? When talking with a person with hearing loss, for example, be sure to face them and don't cover your mouth. ليه؟ إن هم بيبصوا على lips movement, على حركة الشفايف. They are looking for the lips movement. يبقى if you are talking with person عنده hearing loss or hearing impairment, you have to face them and don't cover your mouth when you speak. لأنهم بيلاحظوا إيه؟ الليبس موفمنت, حركة الشفايف, يبتدوا يبصوا على حركة الشفايف. طيب, place yourself so that you face the light source and are not backlight. Wait to speak until the person is looking at you. When meeting an interviewee who has visual impairment, identify yourself and others who are with you in the room. For example, you are this patient with vision impairment coming to you in clinic. You have to introduce yourself, identify yourself. For example, you have nurse with you, assistant with you, you have to introduce also. Whatever with you in the room, you have to identify to the patient. Okay? طيب, listen attentively, يعني listen. Active listening when you are talking with a person have difficulty في speaking. عنده مشكلة في speaking, لازم تسمع له بوضوح وتتكلم معاه بوضوح. Be patient, لازم يبقى عندك صبر and wait for the person to finish speaking rather than correcting them or speak for them. لازم تصبر. Listen actively, shut your mouth, don't speak, allow the person to finish speaking. After that على طول أنت you can respond or speak. Never pretend to understand if you are having difficulty doing. So instead repeat what you believe was said and allow the person to respond. طيب, hearing impaired patient remain within the sight of the patient. لازم على طول, as we mentioned, you have to face them because they are looking for your lips movement. Ensure that the hearing aid is in working order and turn it on. لو هو معاه hearing aid, معاه سماعة, لازم نتأكد إن هي شغالة وفي مكانها المظبوط. طيب, background noise should be at minimum. كل الباك جراوند, لو في مثلا احنا في كلينيك وفي outpatient clinic و too much noise, we can close the door of the clinic. We need to make the background noise at the minimum level, okay? Even with intermediary phase, the patient and direct all communication to the patient. Use facial expression and body movement. Give additional time. Use written form for gathering data. Okay, على طول take care إن هم الناس اللي عندهم hearing impairment على طول they are looking for you for your facial expression, body movement. على طول they are focusing on non-verbal cues. Take care from your non-verbal cues. Okay, facial expression, eye contact, face them. They are looking for your lips movement. Take care. Give additional time to them. Use written form for gathering data. طيب, البيشنت بقى اللي عنده visual impairment, الفيجوال impaired patient Always look directly at the patient. The cues, the voice tonation, the volume, inflection are important. Use therapeutic touch. Advise the patient when entering or leaving the room. You have to inform the patient. تمام؟ ايه هي الروم سيتنج؟ تمام، تعمل له اورينتيشن عن الروم، ازاي هيطلع ازاي هيخرج. You have to advise the patient and help when entering or leaving the room. Orient the patient to the immediate environment. For example, this patient in his room, this is the bathroom here, this is the window, this is the bed. You have to orient the patient to the immediate environment. Use clock hour to indicate the position of items. هنقول له عن طريق عقارب الساعة. تمام. Offer assistance when he need. طيب البيشنت بقى اللي low level of understanding, what we will do with this patient. البيشنت عنده low level of understanding, استيعابه قليل، فهمه قليل، نعمل ايه؟ Take care this patient require time and require patient. محتاجين صبرك مع المريض ده. Interview also the family and caregiver. لازم كمان تقابل الفاميلي والcaregiver. Request permission from the patient to speak to someone else. Allow the patient to ask assistant. Observe the interaction. احنا ممكن نستأذن المريض في الوقت ده. بعد إذنك أنا هتتحدث مع الفاميلي ممبر أو مع الcaregiver اللي موجود. لازم تاخد permission منه الأول. تمام؟ تسأله لو هو محتاج مساعدة وتشوف الانتراكشن بتاعه. طبعا عندي crying patient وفي emotional response عالية جدا. نعمل ايه؟ gently ask what is the cause of emotional response. ايه سبب الcrying ده؟ show empathy مع البيشنت and allow to cry. convey message of thoughtfulness and finish the interview with the patient. خلاص. If the patient crying, finish the interview. Ask for the cause gently. Show empathy that you can understand the situation. You can understand the feeling, okay, of the patient, and finish interview. طيب الانشس والانجري patient اللي دايما anxious وانجري نتعامل معاهم ازاي؟ allow them to express الاموشن. ايه اللي مضايقك؟ ايه اللي مزعلك؟ اساله open end question. اخليه express للاموشن بتاعته. give permission to bring out their feeling. convey the patient's sentiment to their attention. recognize and acknowledge the emotion. هتستخدم كل communication skills open end question, active listening, eye contact to show the interest, allow them to express the feeling. تمام؟ and you have to show sympathy with the patient. طيب الهوستايل بيشنت بقى، البيشنت العدواني اللي ممكن نتوقع منه أي تصرف يبقى في تجاوز للحدود، نعمل معاه إيه؟ لازم you have to be cautious with this patient. Take care from this patient. Don't reciprocate with anger and hostility. تمام؟ Limit setting and focusing refocusing. احنا ما نتماداش معاه في غضبه او نزوده في بزعقنا ليه او بنرفزتنا ليه. تمام؟ احنا نخلي بالنا من النقطه دي. Limit setting، نحط حدود معاه في التعامل معاه. Position yourself near an accessible area او accessible exit. تبقى قريب دايما من الباب عشان لو في حاله حدوث اي شيء تقدر تطلع على طول. Position yourself near an accessible exit. Take care. Don't turn your back to the patient. ما تديش ظهرك للبيشنت لان انت مش هتتوقع ايه اللي ممكن يعمله. Don't turn your back on the patient. Never allow the patient to walk behind you or come between you and the exit. Watch for signs that increasing the patient tension. Leave the door of the room open to some degree. علشان على طول إذا زاد الموضوع على طول تطلع من الغرفة. طيب مريض sexually aggressive patient مثلا مع النيرسز أو مع الفيميل physicians، إيه؟ if you know patients like that, you have to alert your colleague, security. تمام؟ You have to define appropriate boundaries. put limits with the patient, refocusing with the patient, set limits. تمام. how to deal with the angry patient. how to deal with the angry patient. احنا we mentioned صح؟ how to deal, you have angry patient, مريض غاضب لسبب من الأسباب. how to deal with the angry patient. if you have angry patient and what you will do. تمام يا ليان. ايه كمان؟ تمام. eye contact very good. تمام. ايه كمان؟ مريض غاضب زي ده نخلي مسافة، set boundaries, space, friendly behavior. نسأل عن سبب الغضب. تمام يا محمد. نديله وقت. How to deal with the angry patient. Learning how to deal with angry patient or relative is a valuable skill. If you have this skill, this is a valuable skill we can develop to support us in clinical practice. Given the nature of healthcare environment, you will almost definitely encounter this situation. كلنا أكيد بنشوف السيتويشن دي. الangry patient, الangry family, but if you have the skill how to deal with this patient or the angry patient or angry relative, this is a valuable skill. تمام؟ ليه؟ لأن احنا في environment مليئة بالمشاكل بتحصل فيها الموضوع ده على طول. Almost definitely encounter this situation in placement or when you start work. طيب, examples the reason why patient or relative become angry. This is the common example why the patient and family become angry. They have been left to wait long waiting time in ER, long waiting time in OBD or for outpatient clinic. They have been left to wait a long time before being seen in the clinic. An error has been made by medical or surgical team. حصل medical error. تمام. ده يخليهم angry. There has been a delay في diagnosis or treatment. في مشكلة في يعني تأخر في التشخيص، تأخر في علاج المريض. تمام. They have just received bad news about patient مثلا diagnosed cancer, diagnosed serious disease. فدي bad news بالنسبة لهم. The patient or relative expectation are not being met. This issue can be exacerbated by drug or alcohol use, underlying mental health problem, history of anger management issue, and our violence والaggression. طبعا المرضى اللي مثلا اللي بيستخدموا الكحول او الدراج معينه ممكن ده يزود الموضوع معاهم، ممكن يزود الانجر او الاجريشن معاهم او الاجريسيف بيهيفير ده. فدايما لازم يبقى عندنا يبقوا عارفين الهيستوري البيشنت ده عنده اي mental health problems، واخدين هيستوري هل هو دراج والكحول يوز، فلازم يبقى عندنا الهيستوري لان الحاجات دي بتزود الانجري بتاع البيشنت. طيب what you will deal with the angry patient. ازاي هتتعامل مع ايه اللي هتعمله مع الانجري patient. how you will deal with the angry patient. طبعا لا تعارضه، لا ترفع صوتك عليه، طبعا ما نقفش بالند. روح انا هشتكي للمدير، روح اشتكي للمدير، واعلى ما في خيلك اركبه. كل ده كلمات بتزود غضب المريض. فتيك كير، you have to be professional don't raise your voice, allow the patient to express the emotion, search what is the cause of the patient angry. Okay, this you should do. It is very important that we first identify the person we are talking is angry. You have to know this skill, how to identify the emotion. The skill of identifying the emotion is very useful when communicating with patient or relative. Once the emotion is identified, we can then start to respond accordingly with empathy, with reassurance for the patient, or we can apologize for the patient depending على situation, depending على what the patient is feeling and what events have occurred. يبقى أهم حاجة يبقى عندك السكيل بتاعت identifying emotion. Once you identify the patient emotion, you can respond according to situation. You can respond by empathy, you can respond by assurance, by apologize to the patient. We have many responses we can use. You might note the following behavior when the patient is angry. ايه هي الساين والسيمتوم اللي ممكن نشوفها على المريض يقول ان هو angry؟ ايه هي البيهيفيرز اللي عليه تقول ان هو angry؟ loud speech, shouting, swearing والله ويقسم بالله, verbal abuse, oversensitivity to what is being said, aggressive, butchering, not wanting to sit down, رايح جاي بعصبية وبنرفزة. البوتشر بتاعه بيرفلكت اللي هو angry. walking, threatening to walk away, pacing up and down, raise in the pitch of voice, shaking, fist clenching. كلها علامات غضب. كلها ايه؟ علامات غضب. وسهل جدا ان احنا نتعرف على علامات الغضب. change في eye contact, suddenly looking down, frowning. كل دي sign and symptom you can recognize the patient, angry patient. صح الفيشيال expression بتاعته. طيب once you discover بقى and you identify this patient is angry, what you should do على طول you have to adjust your communication style. Adjusting your style of communication when the patient is angry. Once we recognize our patient is angry, and we can adjust our style of communication to try and diffuse their anger or at least prevent them from being angrier. طيب نعمل ايه؟ Number one, your voice. Tone of voice. Adjust the tone of voice. السبيد, الvolume of your voice. Try to keep calm tone and remain composed. This can be difficult when you are being shouted at. ممكن يبقى صعب شوية لو هو المريض بيصرخ عليك. هيبقى صعب عليك ان انت to keep a calm tone. Speak slowly and clearly. Don't raise the volume of your voice if the patient is shouting. لو البيشنت هو كمان shouting, انت كمان ما تبتديش ان انت تعلي صوتك وتصرخ عليه. فتيك كير في النقطة دي. يبقى التون اوف فويس بتاعتك لازم تبقى calm tone of voice. Speak slowly, clearly. Don't raise your volume of your voice. حتى لو البيشنت shouting at you. يبقى number one في adjusting your communication style, number one tone of voice. Okay, calm tone of voice, speak slowly, clearly, don't raise your volume. Okay, حتى لو البيشنت بيعمل shouting at you. If the patient shouting at you, don't raise your volume. Number 2 your body language. يعني for example أنا جاية البوستشر بتاعي واقفة وحاطة patient very angry، وأنا جاية واقفة له حاطة له رابطة له حاطة إيدي في وسطي، أو أنا مكتفة دراعاتي كده. ده ريفلكت إيه؟ ريفلكت إن أنا بتحداه، ريفلكت إن أنا مش مهتمة، ريفلكت لعدم احترام ليه. فتيك كير من البادي لانجوج بتاعتك، البوستشر، الفيشيال اكسبريشن. You have to be professional, adopt professional relaxed posture. If you are seated might be uncrossing your arm, uncrossing your leg. تمام، لو انت قاعد وحاطط رجل على رجل او مربع ايديك لازم على طول تعمل uncrossing. تمام، لان زي ما قلت لكم القعده دي بترفلكت عدم احترام، عدم اهتمام. انا مش فارق معايا اللي انت هتعمله، واعلى ما في خيرك اركبه، وان انت بتتحداه. تمام. sitting back in the chair can help slightly though taking care not to appear like you don't care, to avoid appearing confrontational. ان انت بتتحداه او بتواجهه. طيب يبقى أول حاجة tone of voice، your voice volume. تمام. number 2 البادي language، الفيشيال expression، your posture. number 3 acknowledge the patient anger. في المرحلة دي أنت بتعمل acknowledge. at this stage pointing out to the patient and they appear upset, angry can be helpful. An example might be, you are looking very upset by all of this. Sometimes hearing this back can enable the patient or relative to recognize their emotion and start to process it. The patient might respond in 2 ways. ممكن البيشنت يجاوبك وانت بتعمل له acknowledge، يعني انت بتقول له you are looking very angry, very upset by all of this. ممكن البيشنت respond متوقعها ايه؟ They might correct you. No, I am actually just frustrated. تمام؟ طيب maybe they agree with you. Absolutely, of course I am. You have then confirmed the emotion. تمام؟ يبقى patient ممكن يعمل لك confirmation، you agree with you. Absolutely, of course I am angry. واحد تاني يقول لك no, I am actually just frustrated. تمام؟ try to understand why they are angry. ايه سبب الغضب؟ يبقى أول حاجة adjust your communication style, your tone of voice, number 1. Number 2, your body language. Take care to avoid appearing confrontational to them. طيب number 3, acknowledge the patient anger. You have to acknowledge. For example, you will say, you are looking very upset by all of this. You are waiting for to respond. Maybe the patient correct you. يصحح لك no, I am just only frustrated. أو they may agree with you. Absolutely, of course I am. Okay, this is number 2, not 3, because number 1, adjusting your communication style. Number 2, try to understand why they are angry. Why they are angry, the main cause of their angry. Often there are other emotions behind the angry. For example, frustration or more commonly fear. Ask open question to identify the focus of why they are angry. إيه سبب الغضب بتاعهم? Tell me more. Why are you feeling this way? Okay. Is there anything else that happened that is making you angry? هل في سبب تاني حصل هو ده اللي مخليك angry? Listen to the explanation as to why they are angry. Demonstrate active listening skill زي ال eye contact, nodding للhead اللي انت بتسمعه, ال verbal responses بتاعتك. تمام. فتيك كير. allow the patient to vent at you. لا، خلي البيشنت يعني يقول لك كل حاجة. تمام. completely if needed. They may need to get something off their chest. Give them plenty of space to speak. تمام. Avoid interrupting the patient. تمام. دي الحاجات دي. try to understand الكوز. هنعمل ايه؟ هنسأل open-ended questions. Tell me more why you are feeling this way. Listen to them. Okay, demonstrate active listening. Eye contact, nodding, verbal responses. Give them time to allow them express their feeling. طيب خلاص انت عرفت المين cause of angry. respond بقى. Respond to anger. You can respond to anger. Once you gather the information about the patient anger and you feel that have said what they needed to say, start to respond to their anger and the situation they have. Described alongside answering any questions they may have. تمام. يبقى respond للangry. يبقى number 1, adjust your communication style. Adjust your communication style. Number 2, understand why the patient angry. ايه الكوزز للpatient angry. طيب. Number 3, respond to anger. Once you identify the cause, you have to respond للangry. هترespond ازاي بقى؟ ممكن show empathy for the patient. تمام؟ At this stage, it can be useful to demonstrate empathy towards the patient. Essentially, this is the acknowledgement and appreciation of someone else's emotion. Number 1, empathy. Empathic phrases you could use are like what? Given everything you have told me, okay, it's understandable. You feel that way. It sounds like you have a lot of going on at the moment, okay? It is natural and you are feeling angry. ده طبيعي ان انت تشعر بالغضب. تمام. هتوضح له ان انت فاهم موقفه جدا. تمام. وعارف شعوره وفاهم شعوره كويس. تمام. تعمل recognition لشعوره. When you demonstrate empathy, it can help make patient feel cared about and listened to. This helps build a rapport between you and the patient, potentially diffusing their anger and creating a safe environment for patient relative to talk openly. تمام. يبقى أول حاجة بريسبوند بالempathy. عندنا phrases كتيرة ممكن نستخدمها to show this empathy for the patient. Giving everything you have told me, it's understandable to me. أنا فاهمه ومقدره. تمام. It sounds like you have a lot of going on and it's natural that you are feeling angry. ده طبيعي إن أنت شاعر بالغضب. تمام. Respond to anger by apologize. Apologize if any error has occurred. هنعتذر للمريض لو مثلا حصل delay في الريزلت، حصل error في any medical error, medical ولا surgical، ممكن نعتذر. I am so sorry for this mistake. Okay, has occurred and caused you or your relative harm. Acknowledge the seriousness of the mistake made. تمام؟ خلينا نشوف بس one patient interviewing video.
angry patient or relative is a crucial skill for every doctor. When was the last time you encountered an angry patient or relative? You didn't know how to manage the anger, not knowing what to do or say. It didn't go well. You felt bad for days. Dealing with angry patient is a scenario most doctors find challenging. The problem is, many doctors are not taught how to deal with an emotionally charged patient. It's a natural tendency to feel you are being attacked and become defensive. If you're new to this channel, hi, my name is Dr. Owen. I help high performers create habits to lead a happy and successful life. I publish new video every Thursday on the subject of happiness and success. If you don't want to miss any future video, don't forget to subscribe and ring the bell. In this video, we'll cover some strategies you can use to deal with an angry patient or relative. Let's take a look at anger. What is anger? Anger is an intense emotional response or antagonism towards someone or something, usually combined with an urge to harm. If a patient or relative has become angry, there's generally an underlying reason. There's a variety of reasons why patients or relatives may become angry. If a patient has been waiting for a long time before seeing a doctor, he may become angry. If there's been an error in the treatment or diagnosis, that could be another reason. Or if the patient just received bad news. Or it could be something financial or social that's happening in their life. You might feel the anger is being directed at you because you're present when you're seeing the patient. However, it's important that you don't take it personally. It is important to recognize the anger at the start of a consultation. Angry patients present in two ways. The first one is a loud patient who's oversensitive to what is being said, maybe frowning at you or using abusive language or swearing at you. This is easily identified. Then you have angry patients who are more quiet and show subtle signs. Once you have identified the patient is angry, make sure that your body language is adjusted to deal with that angry patient. Give the patient plenty of space so that you don't cause more tension in the consultation. The key is to identify early signs of anger so you can address it before it gets out of hand. If a patient is standing and you're sat down, invite the patient to take a seat so that both of you are at eye level. Make sure that your tone of voice is calm and collected. You don't want to talk loudly to an angry patient and try to match their tone of voice. Otherwise, things may escalate quickly. It is helpful to point out to the patient how they come across. So you could say, "I can see you look very upset, Mr. Smith." Recognizing the patient's anger allows you to start addressing the problem. The patient may correct you, "I'm not upset, I'm frustrated." Or the patient may agree, "Absolutely, of course I am." It's important that you remain in control of the consultation and don't let the patient to intimidate you. So set clear boundaries and be assertive when you communicate with your patient. Be firm when you speak with the patient and show respect to the patient. Encourage the angry patient or relative to share their concerns, as there's a strong feeling that needs to come out. The angry patient or relative needs to feel listened and understood. Listening actively to what the patient has to say is likely to diffuse the tension and de-escalate the situation. You could ask open questions to understand the anger. "Tell me more, Mr. Smith. What's causing you to be upset?" After you've asked your question, listen actively to what the patient is saying to you. Avoid interrupting them. Give the patient plenty of time and space to vent their anger. If you sense that the patient is getting more annoyed by the question, you could signpost before asking your question, "Mr. Smith, I know you've been patient and I need to ask you a few more questions to help understand what's been going on." Once the patient or relative has vented their feeling, validate the patient's or relative belief. So you could say, "It is completely understandable you feel that way, given what you have gone through." The next step is to apologize. However, be careful how you apologize. If you or the medical team are not at fault, you could apologize for an unfortunate event. "I'm so sorry that you're feeling angry about what has happened." The key is to genuinely sympathize with your patient. Let me give you a working example. We've got Dr. A and Dr. B. Dr. A sympathizes with the patient and says, "I'm sorry this has happened to you." Dr. B says, "I'm sorry this has happened to you." Both of them said the same exact phrase. However, which doctor is congruent? I'm sure you have picked up that Dr. B means what he says, whereas Dr. A is saying this phrase just for the sake of saying "I'm sorry." When you're congruent with your words, the patient senses that you care for them and they're more likely to trust you in your management. If a medical error has occurred, be honest and apologize to the patient and explain this is taken seriously and will be investigated to ensure things like this do not happen in the future. The aim is to demonstrate empathy and let the patient know you understand them, that you're both on the same page and that you're going to work through this together to help the patient. Encourage solution to the problem. Ask the patient or relative, "What would you like me to do to help you?" By asking such questions, you show you care enough about the situation. You show a willingness to help rectify it. Be careful what the patient or relative may request and make sure that you set your boundaries. If you can't give the patient or relative what they're asking for, let them know that you have a dilemma here and propose them something alternative that might help them. Once you have discussed with the patient or relative how you could help them, thank the patient or relative for sharing their personal feeling and let them know how important it is for you to know how they're feeling and how you can help them. Make sure that you formulate a clear plan of actions going forward to help acknowledge the patient's anger. Occasionally, even if you're using these strategies, you might find yourself with an angry patient who is becoming more aggressive and more angry, and you find that the situation may escalate with the emotion going out of control, escalating to a rage. So in this situation, it's very important that you evaluate your safety, and if you feel that you're possibly going to be threatened, you should remove yourself from the situation and prioritize your own safety. Last but not least, when you're managing an angry patient, make sure that you stay professional and calm. Don't use anger to deal with anger. Show that you're empathetic, that you care for the patient, and make sure that you align the patient's goal with yours to help them work through this situation. I'd love to hear how you deal with an angry patient. Write down in the comment section how you dealt with the last angry patient you saw. Let me know what's your takeaway from this video. Write down in the comment section what's your takeaway.
يبقى who can summarize how you can deal with the angry patient? How to deal with the angry patient? Who can summarize? How to deal with the angry patient? Who can summarize how to deal with the angry patient? تمام. Number one, you have to adjust your communication style. Number one, tone of voice, volume. You should use calm tone of voice. Maintain eye contact, your body language, your posture. If you are sitting and crossing your leg, you have to uncross your leg. The same, uncross your hands. Okay, very good. What else? يبقى number one, adjusting your communication style. Number 2, you should know what is the main reason of angry. ليه البيشنت angry؟ صح؟ Very good. How you will know? You should use what? You should use what? To know the reason of angry. What you should use what? Open-ended questions, very good. Active listening for the patient. What else? Now you identified the reason of angry. After that, what you should do, we have 3 main steps. Adjusting your communication style, then you should search for the reason of patient angry. Number 3, once you identified the cause, what you should do? Maybe the cause delay, maybe the cause for the patient angry, they heard bad news, whatever. After that, what you will do? You have to respond for the patient angry. By what? How you will respond? How you will respond? By sympathy, by saying sorry for this delay. Very good. طيب, who can tell me what you should do when you are interviewing patient with hearing impairment? What you should do? Patient with hearing impairment. What you should do? You are interviewing patient with hearing impairment. What you should do? حتى لو معاكي interpreter يا ألماس, in case there is interpreter. طيب, what you should do with the patient? You will talk with the interpreter or translator or the one using sign language. What you will do other than this? عنده hearing impairment, هسيبه خالص هعمل له neglection واركز مع الانتربريتر ولا اعمل ايه؟ Very good يا محمد. على طول face the patient, direct your speaking to the patient, not to the caregiver ولا translator. Okay, don't hide or cover your lips because they are looking for your lips movement. Very good. What else? لو البيشنت using hearing aid, you have to make sure ان هي working وفي correct place. Very good. What else? minimize the background noise عشان نقدر نتواصل مع المريض. طيب, you have patient with visual impairment. How you will interview? patient عنده visual impairment. How you will interview? الverbal instruction تمام. You have to introduce yourself for the patient, and whatever with you in the room, you have to introduce to the patient. You have to orient the patient for the room setting. Okay, here's the bed, here's the bathroom, like that, according to the clock. What else? Clock hour. What else? I will ask the patient if the patient need assistance. Very good, يا أنس. Very good. طيب. البيشنت with low level of understanding. البيشنت اللي عنده الاستيعاب قليل. What you should do with this patient? You have to be patient. You have to give them plenty of time. Okay? You can ask the patient permission to talk with the family member or caregiver. Okay? Give time for the patient to express the feeling, the information, the ideas. Okay, very good. What else? Ask the patient also if need assistance from the family member or from caregiver. Speak slowly, تمام. Paraphrasing, clarifying. طيب عندنا hostile patient. نعمل إيه؟ How we can deal with this patient? البيشن العدواني اللي متوقع منه أي تصرف ممكن يأذينا، نعمل إيه؟ Set limits boundaries. Don't give your back for this patient. على طول be near the exit. Don't allow the patient to walk behind you and the exit. صح؟ You have also to alert your colleagues and security. على طول you have to observe a sign for increasing the patient tension. Okay. تمام يا فاطمة. Who can tell me the main purposes for therapeutic communication? ليه احنا بنعمل therapeutic communication؟ ايه المين purposes؟ المين purposes لtherapeutic communication. الثيرابيوتيك كوميونيكيشن هو كمان لازم يكون effective communication. ايه هي المين purposes للثيرابيوتيك communication؟ ايه الغرض الاساسي من الثيرابيوتيك كوميونيكيشن؟ Number 1 to gather information about the patient عن طريق ان انا بعمل انترفيوز مع البيشنت عشان اخد منه الهيستوري. تمام يا صفاء. او بستخدم therapeutic communication كمان عشان ادي education للبيشنت for patient training. تمام. What else? to change the patient behavior من ال unhealthy behavior لل healthy behavior. تمام يا جماعة، حد عنده أي سؤال؟ Any questions؟ في أجزاء مش واضحة نعيدها تاني، مفيش أي مشكلة. واضح الكلام؟ شكرا يا طارق، شكرا جزيلا ليك. أنا اللي بشكركم على حسن استماعكم وعلى مشاركتكم، الناس اللي شاركت معانا شكرا ليكم جزيلا. احنا خلصنا بالنسبة لنا النهاردة، خلاص خلصنا الكورس بتاعنا. حد عنده أي سؤال؟ شكرا جزيلا، شكرا. شكرا يا صفاء، شكرا ليكم، شكرا لحسن استماعكم والله، شكرا. الساعات ممكن تنزل خلال الأسبوع ده بإذن الله، يعني ما تطولش بإذن الله. شكرا يا ياسر، شكرا يا فاطمة، شكرا يا سعيدة عبير، شكرا يا مكرم، شكرا ليكم حسن استماعكم، شكرا جزيلا. المادة العلمية إن شاء الله بإذن الله هتوصل لكم على الإيميل مع الشهادة زي ما اتفقنا. إن شاء الله you will receive the educational material presentation with the certificate on your email. إن شاء الله within this week also. الله يعافيكم يا رب، وشكرا جزيلا لكم جميعا. تقدروا تخرجوا. العفو. شكرا جزيلا، شكرا. لا هو بس الكورس 2 days only، يومين بس. الله يعافيكم، شكرا جزيلا. شكرا جزيلا. إن شاء الله يا عبد العزيز خلال الأسبوع ده. هي بتاخد لها بالكتير 3-4 أيام. ممكن نضيف يا ابتسام اللينكس للمادة بتاعت الفيديوهات، لأن الفيديوهات دي كان الغرض منها بس reinforcement للمعلومة، يعني احنا بنشرح الكورس وندي الفيديو كمان يعمل reinforcement، لأن المعلومة لازم تتكرر بكذا صورة، مرة بفيديو، مرة بشرح، مرة بصورة توضح لنا الكلام ده. تمام؟ فده كان الغرض الأساسي من الفيديو، مش تابع للشرح ولا كلام من ده، لا كان الغرض منها إن أنا أشرح المعلومة بطرق مختلفة. انا اشرح في العرض، بعد كده الفيديو يعمل reinforcement للمعلومه، ياكد للمعلومه تاني. فهي دي كانت الفكره، الصوره تاكد، الفيديو ياكد، الشرح ياكد. فتكرار المعلومه بصور مختلفه، خلاص انت طالع من الكورس المعلومه اصلا دخلت دماغك. شكرا جزيلا، شكرا شكرا. من تسجيلك لإيه يا مريم؟ للساعات ولا للتسجيل الحضور قصدك؟ بصي يا فريدة، ده مع الأورجنايزر بقى، هو اللي هيحدد الشهادات والساعات، ده مع الأورجنايزر. طالما سجلتي في اللينك خلاص يبقى تسجيل حضورك خلاص. الساعات هتنزل لك على ممارس يا مريم، تشيكي عليها خلال الأسبوع ده في ممارس. Yeah, Almaz, I'm answering some question in Arabic. They are asking for the certificate, for the hour, when they can see in the Mumaris, like this. Inshallah, within this week, yeah, Almas, you can see the hour in your Mumaris account. Okay? Certificate with educational material, inshallah, you will receive in your email also within 2 to 3 days maximum. Yes, yes, 10 hours. 10 hours. Yes, yes, Almas. Because we started yesterday, 2 days. Thank you, Almas. Thank you. And thank you for your participation. Yes, yes. You can leave. شكرا جزيلا، شكرا ألمس، شكرا. شكرا سلمان، شكرا، مع السلامة، مع السلامة. تقدروا تتواصلوا مع الأورجنايزر يا جماعة بالنسبة لموضوع الساعات والحضور. بالنسبة للدورات الجديدة بردك هتلاقوها على الواتس، وإن شاء الله ترسل لكم بردك على الإيميلز إن شاء الله بإذن الله.